Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine chiropractor. I am here with my wonderful Isabella, whom I just adjusted, and we're going to do some DNS stuff, some developmental kinesiology to bring some of the movement patterns, the proper movement patterns back into her surfing lifestyle. So stay tuned. Thanks for watching. This is the very beginning phase of DNS, Dynamic Neuromuscular Stabilization, and I'm here with Isabella. We're at the beginning phase of it, so just thought this would be a good little snippet of what that looks like. So Isabella, we're going to go into the 3-month pose. So your elbows are up there. Good. Isabella has an amazing abdominal cavity musculature, which is fantastic, and that's what we want to bring into the picture, which is the proper breathing pattern, so we can create a nice strong axial line, and then we can build the movement around that. So Isabella, for this, we're just reviewing your C5, middle of your neck. You're going to relax it, so you're not going to push it down, but you're going to engage the muscles back here. Good fix there. You're going to make your rib cage drop a little, so it's in a neutral position. That looks fantastic. The knees go out and the feet are in a little bit. That's fantastic. Now you're going to laugh into my hand right here. So go ahead and do that with your mouth closed. And engage that. You already know this. I'm just saying it for the sake of the video. So you're going to engage that. And now we're going to keep the pelvic diaphragm engaged and push my fingers out. So engage this barrel and distend. You did a great job. And make your tummy nice and big. So we live in a society where hourglass and six-pack is very much sought after, but in reality, when it comes to breathing, we don't want to have that. We want to have this nice big barrel that Isabella is so good at maintaining, so we can maximize the amount of oxygen here, and the pelvic floor and the abdominal diaphragm can toss the air back and forth, and that is so essential in the movement of your internal organs as well, because some degree of movement and no compression is needed for all healthy organs. And then from this diaphragm to the cervical diaphragm, where the lungs reside, that's where the air goes out. So in Isabella's case, we're going to sustain this pressure, which you're so good at. Seriously, you're the best patient when it comes to this. And you're going to sustain that as you're breathing in and out. So I really think the fact that you're a surfer practices this quite a bit, because you want to be able to sustain yourself on the board as you're going and paddling, going forward, and all that jazz that you do. So now you're going to bring your arms up. So bear in mind your scapula, your shoulder blades are going to be staying there. You don't want to allow the top of your shoulders crawl close to your ears, so you want to hold this up. Nice. Remember the buck arms. You should be able to sustain this in a nice, relax. The whole spine's against the floor. This is nicely engaged, and you should be able to hold and move this around without any problems. Remember the triple flex, so you're going to engage. Very good. You're going to engage the lower ab. You're going to hold the legs up. So at this point, it's 90, 90, and 90. That's what triple flex is. I want you to keep everything nice. You're holding the C5 nicely, and you can go ahead and reach down to the knees and up. Do it again, and up, and keep doing that. So this is the very beginning phase of retraining the movement, establishing the very base before we build other movements on top of it. This is something that everyone, no matter what kind of problem brings them to the office, will end up with. This is how we as babies started to move. And anyway, thought to share this little snippet of what we do with Isabella with you. Hope you enjoyed this. If you liked what you saw, please subscribe to my YouTube channel, and do know that every decision you make was made by you, so make it a wise one. Thanks for watching.